Meantime, legislation to improve mental health services for Minnesota's emergency responders continues to work its way through the Capitol. The House passing a bill supporters hope will provide frontline police, firefighters, and others more resources and keep them on the job if they suffer from post-traumatic stress.
Paul Bloom digging into this for us tonight. So, Paul, the bill does have bipartisan support, but some who have served their communities now concerned about their benefits.
Amy Kelsey, no doubt this is a delicate debate at the Capitol. There are those in St. Paul who believes something absolutely has to be done here to shore up the pension funds for the state's first responders. This package does that, more than $100 million, and is aimed at keeping more frontline emergency personnel who risk their lives each and every day on the job.
I dedicated my life to serving and protecting my community, but now I was one who needed protection and support.
Derek Cruzy is a former South St. Paul police officer shot in the line of duty 5 years ago.
That day, my life forever changed.
On Tuesday morning, he recounted his mental health deteriorating, contemplating suicide before retiring from the force with post-traumatic stress pension benefits. But now he's got some big concerns about what new legislation will mean for himself and others who find themselves in a similar spot.
Instead of being valued and supported, this bill shows that the state believes we are disposable and our sacrifices do not matter.
This is an emotional issue. This is a difficult issue, but it is also a really important issue.
Late Monday, the House passed legislation supporters hope will actually keep more emergency responders on the job while providing improved mental health benefits to combat the toll of trauma on individuals. A huge concern in communities both big and small, including Minneapolis, where scores of payouts to retiring first responders following the police murder of George Floyd and subsequent unrest has added up to tens of millions of dollars. This bill requires up to 32 weeks of mental health treatment before an applicant could apply for duty disability pension. However, while undergoing that treatment, the individual is guaranteed their full pay and employment benefits.
This issue is an issue that impacts our officers from the day they start until the day they retire, and that we need to look at the entire spectrum and say, how do we ensure that officers coming in will have a plan when they are ready to retire, or should they become disabled in the process, that they have those benefits there.
And the chief bill sponsor there insists the state has the back of its emergency responders, pointing out if the pension fund isn't protected moving forward, everyone employed in the field will soon have to pay significantly more into the system to sustain it. The Senate has a similar bill. The measure hits its next committee in that chamber tomorrow. Paul Bloom, Fox 9.
All right, thank you, Paul.